And I think any doctor will be happy with that. But digital transformation is not something any single doctor clinic can do. It involves a whole lot of digital tools, which are now expensive as well, but it's becoming cheaper and it's becoming more affordable. So some of the digital transformation techniques which I want to talk about is AI ML. I'm sure all of you know what is AI, what is ML. But I will show you a little later how it's applicable to healthcare. And then we create what's called an integrated digital health ecosystem, so that we make sure that the patient is completely interconnected with the doctor, post-operative, pre-surgical, in every other way, and make sure that regular, even medication updates are being given. So that is what I call a completely integrated digital health ecosystem. And then now we have what is called remote patient monitoring, which is very, very interesting. And we have developed something. We have another company called Helia Digital, based out of the US, of which I'm the CEO of the Indian arm of that. And there, what we do is we have remote patient monitoring system. For instance, our diabetic patients, the moment what we tell them is every 3 days they have a machine and they take their sugar levels, right? When they take the sugar levels, there is an app, and at the moment the moment they take the sugar level in that machine, the value automatically comes onto the app. They don't have to enter anything. It's connected to the app, and immediately my nurse will know, and the routine values will not be flagged. But we'll keep a range for each patient, depending on the age, depending on the sugar level. We'll keep a range, and if it goes out of the range, it gives an alert immediately to the patient as well as to the doctor. So now you can understand how powerful that is, because earlier people will just go home and forget about their sugar control till they come next month or 2 months later to the hospital. But now it's not like that. With remote patient monitoring systems, the patient's BP, sugar, the moment they take it, if there is anything abnormal, the doctor knows it, the nurse knows it, and the patient knows it, and we're able to intervene immediately and sort the problem out, right? So I'm sure you all agree that this is very, very interesting and very important. And at the right time, intervention is very important, especially in long chronic diseases like hypertension and diabetes, right? So this is where I would like somebody to ask some questions, or I would like to have a brief few minutes discussion on this, if you have any questions.
Sir, one question is there. Is
Sure.
there every means parameters are equivalent correct in all these technologies?
Yes, they are. See, this is all FDA approved. We have tested it with a normal equipment. We have done it through this, and it has gone through US FDA approval. So these are all what you call medical grade. So without having that FDA approval, or the Indian arm is called the CDCSO, without having that approval, we cannot use this to diagnose, right? Remote patient monitoring systems is not just a screening tool. We use it as a diagnostic tool, which means based on that, we give medication. So it has to be accurate, right?
Sir,
Okay.
it is not available. It's available in India,
It
in,
is. It
uh,
is.
any app. Could you please mention it where
See, the latest thing I have seen is it's called AVA, EYVA, AVA. Please go to the website on AVA. You can buy a small device, and the best part of it is this device is a non-invasive test for glucose. It's not even invasive. You don't need to prick your finger for blood. You just
okay.
put your finger on it and gives you the blood sugar reading.
And sir, it is connected to the
Yes, yes, yes. Instrument comes with app. You have to download the app.
Okay. Okay.
Yeah, it comes. And like this, there are so many more. Ava is just the latest one I've seen. It's a Hyderabad-based company, and it's very, very good. But there are at least 50 more apps in the market.
So it's a good one, sir. It's we can opt for this
Yes, you can.
for our family.
Definitely you can. Definitely you can.
Okay.
Okay.
Thank you.
So one more question, sir.
Please go ahead.
Most of the in most of the villages, people are illiterate and uneducated.
Yes.
How this could be more useful for them?
See,
Only in the presence of healthcare workers and NGOs who are there, they will help. In the
yes.
absence of them, how it is useful?
Yes. So So that's a very, very good point. Okay, that's a very good point. So what we have, there is one system in one of the companies where I'm an advisor and a mentor. We have developed a system where we place a machine, okay, in the PHC, in the primary health center. You know, most of the village, every 10 villages now has a primary health center in India, right? So in the primary health center, when they have to come, they are registered with the primary health center because, like you rightly said, some villagers will not know how to use these technologies, right? But
Yes.
we place this at the primary health center, and when they come to the primary health center, their records are all available to the doctor who sits in the city. And believe me, the systems which we have developed, for instance, you know, I'm sure all of you know what is diabetic retinopathy, right? So
Yes.
every time the patient comes to the primary health center, the ophthalmologist is sitting in the main hospital, which is 500 kilometers away, but through the system we have developed, can actually see into the fundus of the patient. They can actually, that is what is called remote patient monitoring. This is a very
Okay.
advanced system. Yeah, this is not something where the other student was asking little before, where you can buy and keep it at home. This is a very advanced system and it costs about 10 lakhs for each PHC, but we are working with the government for this. And if the patient comes and if we want to check their eye, they just have to put their eye to there is a small monitor there. And on this side, the ophthalmologist sitting 500 kilometers away can actually see the fundus and examine the fundus to see if the diabetic retinopathy is worsened or better and treat accordingly. So they tell the medications then to the nurse in the PHC and then it's given. Okay. So
Okay.
right now, this is how we are overcoming. See, technology challenges will always be there. Not everybody can adopt tech, isn't it?
Yeah.
Yeah.
That's
But
true.
we are trying to take it rural by making all these kinds of adjustments and making sure that at least they come to the PHC. See, if
Yeah.
otherwise, for that lady with diabetic retinopathy, will have to travel at least 200 kilometers to the city and meet an ophthalmologist.
Hmm.
Here, she doesn't have to come. She comes only once in 6 months to the city.
Yeah.
That is the advantage. Okay. Okay. So I'm just briefly going to summarize this. Digitization is very simple task oriented, like scanning. Makes normal written data as digital, and it's basically a data conversion. Digitalization, very process oriented, right? Like an EHR, it's a process. Improves your operations, and goal is to be more efficient. Digital transformation is an organization-wide thing where the management buy-in is very important here. You cannot just, one doctor say, okay, in the hospital, I will be digitally transformed. No, it cannot happen. The entire hospital has to be involved in digital transformation. Fundamentally will change the organization. By saying that, I mean the organization will become much more efficient in the way they function. And then, of course, innovation and value creation as well. Okay, so I'm sure I hope all of you have understood. So I'll stop here briefly and take any questions now in these three things. If we have digitalization, digital transformation, or if there's anything you know about this and you want to tell me, I'm happy to listen.
Excuse me, sir.
Yes, please.
Yes. So with all this digitization, there is one basic concern, that is data privacy, right? How and what safeguards are in place to prevent misuse by private or tech platforms?
Brilliant, brilliant. See, that's a lovely question. So I can definitely understand that you're exposed. So one of the biggest problems is data privacy, especially in healthcare. But see, in the US and in the UK, there are strong safeguards. Those safeguards are not yet in India, but it is now coming up. So, for instance, I will tell you how we safeguard it, right? So, whatever the data which is collected, it is stored as something called the metadata, which means it will mask all the names, right? It will only come as a patient details. So, nobody outside the server will have access to it, right? And when we put it on the cloud, we have what we call as buckets. It's a little technical. We have buckets where no one, for instance, multiple companies we are dealing with, they'll all be in different buckets. So nobody, there won't be any cross contamination, and no one will have access to any of the names. But the data access will be there. The doctor will know. For instance, the doctor who's getting the data will only know this, unless the patient is a patient of this particular doctor and they've been regularly consulting, just like you go to hospital. Otherwise, data is completely masked. So only the metadata is available, right?
Yes, but still there have been instances of data breach. And in US we have they have like HIPAA Act. Do we have something similar in India yet?
We actually we don't have a standard like that yet here, like I told you.
Right.
But many of the standards which, see, for instance, if you are or international, see, for instance, if you have an international patient, right, you need to be HIPAA compliant. So most of the softwares which are now coming out are HIPAA compliant. Okay, there are certain standards, but they are not as strong as HIPAA and HL7 actually. Now it's the latest standard now, HL7, right? So, but I mean, there's a task force now in the government which is working on these digital securities.
Okay, sir. Thank you.
Thank you. Anyone else?
Sir, cyber security will play a role in patient
Of course, of
security.
course. Yeah, cyber security. See, every app. See, the agency like FDA in India is called CDCSO.
Yes.
Now they require something called a security check for every app for the security of that, so that they make sure that data is not leaking anywhere. Only after the CDCSO gives their approval can we even launch the app in the App Store, whether it's an iOS or Android.
Okay. Okay,
Yeah.
sir. So protected.
Yes, yes.
Secured.
Everything is data protected.
Okay. Okay, sir.
Yeah. Anyone else?
Sir, what are the career growths in this?
I mean, the career growth in this one is cybersecurity. It's a brilliant field now, believe me. Whether it's in India or abroad, it's one of the biggest growing, fastest growing fields. So cybersecurity, if anyone of you are interested, please get into that, especially in health. Huge field and very well paying. That is one. The second thing is data analytics. I told you. I mean, see, all the health companies, you take any insurance company, you take any big hospital, there's huge amounts of data. We need somebody to read the data and tell us, right? So that is where we need somebody who is very, very strong in data analytics to go through all that massive amounts of data and take out insights and say, for instance, I'll tell you, so many patients are coming from this area with kidney stones. Then we'll understand why is that, because there's some water problems there, maybe hard water. Then we focus more on, that area we focus with our urologist more. You understand what I'm saying? So you should, the data analysis is one more very, very big field. Again, believe me, very high paying field for this. Apart from many other fields which are now coming up, like for instance, healthcare AI, and I'm sure all of you know clinical research. There's huge amounts of, thing in that. And of course, bioscience, biotechnology, robotics. All these are very, very good careers to have. Right? So can I move on?
Sir, one more question, sir.
Go ahead.
As you say, this digitalization is far approaching and it's good and very accurate. What about the virtual care? It might lack the emotional touch and support that we offer for the inpatients. So how would that work out? Like, for example, some patients would have been through a lot and they will, ask for emotional support. So this robot and all these things, digitalization, it might lack that part, right? So how that can be counteracted?
Okay, so again, that's a very good question. Now, what I'm going to say for this, the answer is what's the future is going to be not only digital. This will be phygital, or what I call a hybrid model of healthcare. You understand? So it will not be digital. Digital is good for some kind of scenarios. People who hybrid, that is brick and mortar hospitals, will also be there. Okay, so it has to be a combination of both. That is what is important. But having said that, I'm going to talk about something which I don't know how many of you heard this term called metaverse. Okay, so metaverse is something which is known to very few, but let me explain it very easily. You talked about touch, right? So metaverse is something that you wear glasses. How many of you heard of the Google Glass, right? So you just wear it now. See, Google is coming out with a very advanced version. Not only Google, there's so many other companies which is You put on the glasses, right? They say another 5 years, you don't need your mobile phone. Your glasses are going to do everything for you, meaning you can take a call and you look at it, there's what do you call AR, VR, virtual reality, augmented reality, everything built into it. And the part of that is you wear these goggles and then you enter into a digital world where there is a real hospital. There's a digital hospital. What I mean by saying that is, once you wear your glasses, you will actually be able to see the hospital. You can even walk to the hospital. When you walk inside the hospital, you will see dermatology. And when you go there, you can actually touch the patient. The doctor can actually touch you digitally. That's the best part, right? But again, please let me tell you, this is very futuristic. People are actually doing it, but there's something called haptics and virtual reality where you can even touch it. You can feel the touch when you wear the glasses. Okay. So again, but this is very, very futuristic. In the end, I have something to show you, which will probably, blow your mind there because this is the future. But we are starting to do work on that. I'm also involved with the company, virtual reality, and they're really doing all this. Okay. But the real answer to your question is you have both virtual consultation as well as the people. For instance, if I need a skin consultation, I'll happily do a telehealth consultation, right? A telemedicine one. But if my father wants, no, I want to go and see a doctor, then I would suggest that he goes and sees a doctor. So it's up to the patient to decide that. Okay.
Thank you, sir. That was a very nice and informative answer.
Thank you. All right. So I'm just going to be moving on. Okay. So what is digital acceleration? Now, see, we need to digitally accelerate in hospitals. Like I told you, not all hospitals can do this. Not hospitals can afford it, but they should start digitalizing at some point, and also digitally transformation. Why I'm saying this is, if we don't do, any hospital which doesn't do this will be left behind. Believe me, will be left behind. And, I've been a keynote speaker in so many digital health conferences. The two big examples I give them is Kodak, right? I'm sure all of you heard of Kodak. Kodak is the biggest camera company, the film company in the world earlier, about 20 years ago. And a scientist from Kodak actually invented the digital camera, right? He was actually part of Kodak. He was a scientist from Kodak. He went to his boss, the CEO, and said, I found a beautiful way. We don't need film to store pictures. There is a digital way to do it. Can we adopt it? The CEO said, are you crazy? 95% of our business comes from film. And are you trying to put us out of business? This guy left Kodak, went to Sony. Sony, brought out the first digital camera. In 7 years, Kodak went bankrupt. 7 years. And I'm talking about a company like Kodak, which was billions of dollars. So any company which you're not keeping up with the times, you're going to completely lose out. You will become irrelevant. And the second common and biggest example I give is Nokia. All of you know how big Nokia was. And Samsung came and said, we're going to put a screen. Nokia said, a phone is only for talking. Why do you want to put a screen there? And Nokia, within 4 years, got wiped out by Samsung. Right? So please understand, if you don't think that digitalization is not, is not relevant in whatever your field and whatever you think, it is now relevant in every field in the world. And believe me, many people think AI and all will take away jobs. It will not take away jobs. It's going to create more jobs. But unless you learn AI, you will be out of a job. You should learn AI and other things. At least you should know enough to continue your job and become better at it. Upskilling is very, very important in that area. Okay, so please understand, digital acceleration can happen in different hospitals, different fields, different sectors at different speeds, right? So rapid implementation, I know some big hospitals who have done beautiful work. Apollo is one big example, you know that. And please, one more very important thing is interoperability. This is very big in the US. In India, we don't have this yet, but it's happening. It's happening. There is a central exchange where within a couple of years, all hospitals will be by law required to share data with them. So anytime you go to any hospital, your records will be available, right? You don't have to keep carrying tons of papers and films with you. That is called interoperability. And the priorities of key technologies. Like I said, different size of hospitals can actually afford different kind of technologies. So prioritize whatever helps you first. I wouldn't say a small 50-bed hospital or 100-bed hospital cannot become a smart hospital, right? You go with RPA, what is robotic process automation. Start slowly and then start building up digital transformation. And finally, how does it help you? Data driven decision making, right? And that's become very, very important now. You don't just massive amounts of money are just spent by hospitals for marketing. We were trying to tell hospitals, and at least in our hospital, we make sure that everything we do, every marketing spend is based on some data from the market. Okay. All right. Let me talk about some of the key digital acceleration strategies. Okay, so I think I've talked. Okay, health record, we already spoke. So interoperable health EHRs will consolidate a patient's medical history from various sources, providing clinicians with a comprehensive view. See, if I have an EHR in my thing, all I need to sit on my laptop or sit on the hospital desktop, and then I type in a name, I get all the previous history. You can imagine as a physician how important it is to me, right? Instead of saying, please show me your records, and many of them forget, they say, they will tell us, right? So that is completely eliminated when you have a very strong electronic health record with interoperability, which is now coming. And of course, clinical decision support is a little more complicated. You need AI and all that, but basic stuff, it can give you alerts, reminders, etc. And then real-time access to data, again, will happen when interoperability happens. Data-driven insights, I think we've already spoken about it. Yeah, so telehealth and remote patient monitoring is actually a very pet project of mine. I've done I don't know 2-3 companies we have done, and done beautiful projects in this one. So what we found is it removes geographical barriers, and as many of you said, rural health, beautiful. It helps. So we are now in Madhya Pradesh. We use this project. And, just with their Aadhaar, people come from the village. We know who they are. We know their history. And our doctor sitting in Chennai can actually examine them there with only a couple of nurses in that center. So it actually cuts down cost tremendously, and a specialist consultation available. I'm very happy to say we have saved lives, with this one, because see, many times when people with chest pain go there to these PHCs, some nurse will, or one junior doctor sitting will say, give them medicine for acidity and send them home. Right now, it's not like that. They take an ECG, my cardiologist sees it immediately and says, they're going through that, they're going through a mild attack, give them this. And then if it's very, very critical, if they're in an evolving MI or a myocardial infarction, say shift them to the nearest hospital. We actually are saving lives there. Okay, and that's how. And that is what the aim of digital transformation is. You need to make sure that lives are transformed with this one, right? And chronic disease management, remote patient monitoring is a boon. Believe me, my own mother, every time mango season is there, she's a diabetic. She will eat it, and she will tell my nurse, no, I'm fine. All sugar levels are fine when she tests. But after the remote patient monitoring, the moment she tests it, my nurse knows it, and make sure she tells her, make sure, that control is established. So compliance is very, very good with remote patient monitoring. And of course, increased access for elders. People can't travel, elderly people. And telehealth is very, very important for them. And it promotes patient engagement. AI for diagnostics and decision support. Okay, I'm not going to talk too much about it. It's a little deep, but medical image analysis, I don't know how many of you have heard this thing called Google DeepMind. There was a study done 3 years back where Google DeepMind was fed about 100,000 images of mammograms. Okay. And after, not 100,000, 500,000, 500,000 images of images were given to Google DeepMind. After it absorbed all the data, they gave about 50 real images of mammograms, some with cancer, some without cancers. And they gave it the same thing to 3 other top mammo specialists, radiologists in the world. And actually, Google Mind did better than all of them. So that is the kind of AI which is coming. So there are many fields in medicine where, like, for instance, radiology, where, you may not need a radiologist to actually read X-ray, CTs, because AI is going to do it better. All right. So enhanced diagnostic accuracy, same thing. The doctor actually saw it and said, no, this is no cancer. The patient, the AI, Google DeepMind said there is early cancer, and they found that it was there when they did the biopsy. So that is because, it has seen, hundreds of thousands of images, and it's far more accurate than the human brain. And this AI can actually personalize medicine, right? That is one of my pet topics where, we have genomics now, where you do a genetic test. I'm actually, in our hospital, we have introduced part of a health checkup, a small genomic test also. It will tell you if you are prone to cancer, if you're prone to heart disease, which is in your genetics. A healthy guy will, all your normal health checkup will be normal, but the genetics will show that this patient is prone for cancer. So we advise them accordingly. We counsel them and make sure, they're a smoker. We say, stop smoking. That's because something in the genetics is making them prone for it. And personalized medicine, believe me, is the future. And then it reduces clinical burden because it gives you a lot of insights. Otherwise, the doctor keeps breaking his mind, says he thinks one is the diagnosis, goes back, gives medicine, then the patient comes back and says it's not working. Then you change. But AI is helping us to come to the right decision very quickly. Okay, so before I go to the next one, can I have some questions, or do you want to talk anything about this? About AI in diagnostics and the previous one, telehealth and remote patient monitoring?
Hi, sir.
Yeah.
Yeah, in telehealth, there is in India, there is a different languages. How can the rural peoples and all understand that languages?
So, see, telehealth is now available, telemedicine is now available in multiple platforms. For instance, ours is available in, I think, in 10 languages. You can use it in Bengali because we have a very strong presence in West Bengal. You can speak Hindi, you'll understand Tamil, so English. So it's more and more thing, and now you have many translators available.
Yes.
Okay. Great. Anyone else?
Hello, sir.
Yes.
I had a question regarding if there's any error in the software or the AI algorithm, how is it dealt? Because everything is digitalized here.
See, believe me, AI diagnoses are now verified by physicians, right? You're right. There is a margin of error for AI because it's not 100% accurate yet. So AI now helps us only to guide us through to a diagnosis. Okay, so the systems where AI will take over diagnosing or give us accurate diagnosis is still some time away. I'll show you an app at the end of this, another 10 minutes. I will show you an app where it's a very, 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 very advanced app, and I'll show you how AI is working there. But it's only used as a screening tool. We don't use it as a diagnostic tool yet. But I'm sure in a couple of years it will become diagnostic. But you're right, we can't trust AI fully. We advise that physicians use it only as a guide right now. It helps you think better. That's all. Right? Do you have any other questions now?
Yes, sir. Sir, like BSc nursing student,
Yeah.
remote monitoring patient jobs role will be available in company sites or more than hospital sites, sir?
What will be available? I didn't get that
Jobs,
question.
jobs, jobs, jobs.
Jobs for BSc nursing. See, I will tell you, hospital obviously are the biggest absorbers of employees of BSc nursing, right? Hospitals are the
sir.
biggest employer. Yeah, some
Yeah,
people
yeah.
with a little bit, more technically oriented may go into companies, but hospital, see, I'll tell you, in COVID, there is a company called Lifesciences. Okay.
Okay.
There's a
Yeah.
company called Lifesciences. In COVID, I made sure my nurses enter the room only once a day, but we took the vitals 3 times daily. How did I do that? Because we had a software where there was a small patch on the patient's chest, and that transmitted all vitals to the nurse's station itself.
Sir, like remote patient monitoring system, it's available in hospital also.
Yes, yes, it is. In hospitals, our own hospital we have. In COVID, because see, I didn't want to expose my nurses to COVID, right? Obviously, even though they
Yeah.
wear masks and all that, there is always a chance. So they went inside, and physically, of course, we can't not go inside the room because otherwise the patient will get unhappy. But we made sure we limited the exposure to COVID. Every constantly, see, my father was admitted. Let me tell you, on my mobile phone, I was watching his continuous heartbeat, his continuous pulse rate, his continuous SpO2 because of this software, because he had a small patch on his chest, which gave me all the data. And that, let's say about 20 patients are there in one ward, all the 20 patients data was in the nursing station on computers. Okay.
Yeah, sir. Can you mention a few hospitals for overall monitoring system is available in hospitals?
See, Apollo is definitely one. Kaveri Hospitals, have you heard?
No,
Kaveri
sir.
Hospitals. Okay. So
Yeah.
Kaveri
Yes,
Hospital,
sir.
yeah, that is one. In Chennai, Sims Hospital is one. The Aster Group is one. So
Okay.
there are I mean, most of the big hospitals have remote patient monitoring, right? But few
Like,
hospitals use
uh,
it regularly.
yeah, some small hospital it's not available, no?
Not available, yeah, no.
Eh,
Like I said, see, remote
hmm.
patient monitoring is a little advanced digital transformation. It requires money. So
Ah,
bigger hospitals are doing it now, but little by little, it will become even smaller hospitals will start adopting it.
yeah, sir. One more question. What is the starting entry salary for that remote monitoring patient?
See, that is why you need to upskill yourself, right? If you are able to understand and digital remote patient monitoring, then
Yeah,
you know, when you say that you understand now, if I know that you know that, I will definitely pay a higher salary. So salary will depend on the city and which hospital, right?
yeah,
But
yeah.
definitely you will be paid a higher salary than nurses who don't know that. So which is why wow. So, which is why I request all of you to understand upskilling is extremely important. And at the end of my talk, we'll talk about upskilling. Okay.
Yeah. Fine. Thank you, sir.
Sure. Okay. So let me move to the next. I think we have very little time. So benefits of digital acceleration for medical administrators like me. I know my hospital has become extremely efficient, and believe me, wherever I'm traveling, Middle East, US, Europe, I always know what's happening in the hospital on my mobile phone. Improved financial performance, definitely. I know I've reduced so much of operational cost by digitizing and digitally transforming my hospital. Enhanced decision making. Some decisions are very, very simple because my data is very easily available to me. Regulatory compliance, it now does it on its own. I don't even have to involve in any of this. And scalability and adaptability. See, we have a common SOP. This system is in all my hospitals is there, so that we know that everything is has a certain standard, and I can go on, you know, tying up and building new hospitals, and it will have the same level of standard. And for doctors, they have improved access to patient information. They can collaborate easier with other, what we call cross-functional treatment. You know, many times patients will need not just one specialty, but multi-specialty, and that's where all this digital transformation really helps, increases efficiency and reduces the burden. We already saw that. Definitely improves patients' outcomes, boys and girls. You must understand it improves patient outcomes, and that is the whole point of digitally transforming. And then continuous learning and development, for sure. For patients, you have increased access to care, right? Excuse me. And then increase patient engagement. We have our app has, you know, it sends out reminders, everything it does. Any new schemes are there, it sends it out on the app. Enhances your patient experience, of course, improves health outcome and increase convenience for the patients. So this is actually the conclusion and the call to action. The core message is strategic digital acceleration is not just a trend. I want all of you to understand this. It's a necessity. And if you don't do this, you're going to be left behind. Collective responsibility is that it is not just a few individuals getting into it. It has to be everybody. The entire ecosystem has to get involved in digitally transforming, which means right from the basic, you know, from your billing to the pharmacy to your nursing station to the theater, operation theater, to the doctors and your post-operative ward, plus your critical care. All these departments have to get together and become computer and digitally savvy for it to work well. And career growth, upskilling is not just about keeping up, it's about professional development and opens doors to specialization, leadership roles, research and teaching positions. I know it does all of these things. So I'll just briefly go through some of the emerging digital technologies. Personalized medicine already spoke about. See, VR and AR, I am advising a company on VR. So I'll tell you how virtual reality is very good. Okay. So one is for patient rehabilitation. For instance, in pain management, right? Pain, you know, people with chronic pain like cancer pain and all that, you know, no, even if you give morphine, it's only a temporary thing. After some time, the pain comes back. We have found that virtual reality, you put on a goggles, play some nice music, play some certain types of programs. If we found that it takes their mind off the pain. So anything to take the mind off the pain is useful. So we're using actually VR, which is first used for what we call PTSD. I'm sure you know, post-traumatic stress disorders and pain management, mental health therapy. Virtual reality is coming in a very big way. But what we have actually done is we have done a training module. See, for instance, in surgery, how do surgeons get trained? They get trained on patients, right? And when a new surgeon is operating, he might make mistakes. So, and that mistake is not very good for the patient, right? So, what we are now doing is, for instance, if you're doing a gallbladder surgery, we have now created a virtual reality image, and they put on the goggles and they wear gloves. The surgeon wear gloves, and you can actually learn. That's why you call haptics. When they cut the gallbladder, they get the feeling of cutting just like an actual surgery, right? And now the new thing is we are also trying to introduce, when you cut something, blood comes, they can even smell it. So that's all the latest technology. And if you make a mistake, we are trying to what we call gamify it. So which means when they make a mistake, they can go back and they'll relearn that. And they get points for that. And it has been proven now that at least about surgeons who are trained on VR are 30% better than surgeons who don't train on VR. So VR is here to stay. And there are other technologies we're doing in VR, very advanced, but I hope I get another chance to talk to you and talk about all that. So advanced robotics, as you all know, surgical robots have become very good. We have one of the most advanced robots called CMR in our thing. And IOMT devices are, like I told you, remote patient monitoring. And AIML we spoke, data interoperability we spoke. So now I'm going to talk about importance of upskilling. Please understand medical technology. Why do you have to upskill? Because technology is constantly evolving. Believe me, even for hospitals, I understand, how much of time I've spent, making sure my doctors are digitally upskilled. Even now they resist, but I've told them we have created a course for them and we make sure. And actually, we are now talking to some state governments to make it part of the MBBS curriculum. Definitely, so that they must upskill themselves. So all of you on the life science must upskill to use the effectively and safely use these tools. Evidence-based, unless do this, you will not become evidence-based, and that's the future. No longer, doctors will or even clinical research. You need to do everything with high evidence-based knowledge. And this is how you future-proof it, right? By like somebody asked, what are the career opportunities? If you really want to grow in a career opportunity, either in India or abroad, you have to embrace digital technologies. I'm sure Clini Launches, I saw that they were doing so many technologies. It's wonderful to see that. Please learn it. And online, Coursera and Upgrad, and there are so many other Udemy. They offer courses, many of them free, some of them very cheap, as cheap as 500 rupees. And it takes you can do it in your own speed. Don't miss a chance to upskill yourself, please. Okay, so this I've actually come to the end. I think yeah. All right, we already passed my time, but I would like to take some last questions before I show you a video of what one of the apps I've actually developed. Excuse me. Are there any questions now?
Sir, actually, what are the disadvantages of this digitalization?
See that we actually spoke about it. Many students have a fair idea. The disadvantages are the security, that is one. Okay. And then accuracy, that is two. These are the two main challenges we have. Not all digital technologies are accurate and not all of them are secure. But with time, like all new technologies, it will take time. But if we wait for it to become absolutely perfect, it will become too late. Okay.
Yes, sir.
Okay, so Debesh has asked something on my chat. For streams like biochem or bioinformatics, which industries are more specifically, which companies? See, biochem are basically research positions, right? Pharmaceutical is, I think, the ideal choice for biochem or bioinformatics. And bioinformatics, even some robotic companies are now looking for bioinformatics. But pharmaceutical is a huge field where it's entry level at biochem or bioinformatics, a good paying job, but then obviously you need to really go deeper and deeper, like do your master's and your PhD as well, and digitally upskilled is very important. Okay, so there is another one. Masudev said, sir, what if the relative of the patient who's also a known case of T2 diam. I use that machine to measure blood glucose. How can we come to know? No. See, this is very, very important. If somebody see that machine is meant for that patient only. It's if somebody else uses it, definitely it will go and land into that patient. We cannot at the moment we don't have any way of differentiating between them. That machine is meant for that patient, and all the details which come through that machine will be taken as that particular patient. So it's up to the patient to make sure that data is secure, Vasudev.
Okay, sir.
So Rifana is asking, so you said you don't have to prick your finger, you just have to put your finger and see how. See, the sugar level is calculated by various methods. Okay, so they have a particular mechanism. It's just like SpO2, right? You just have to put your finger and there's a sensor. So these people have used a sensor. They've done very, very intense research, and it's extremely accurate. It's just like using your what we call CGS, right? I mean, your the small machine, random blood glucose machine that you use. It's as accurate as that.
So
Oh,
is it like the glucometer that is being trending these days?
yeah, it is like the glucometer. It is like the glucometer. Yeah, it's getting more and more accurate. So very soon we feel it's going to be as good as drawing your blood. Okay.
Sir, I have one query. Sir, in the hospital, this is basically related to the medical thing. I want your insight if there is such advancement in the dentistry field also in the general or multi-specialties hospital regarding.
So sorry, ma, can you repeat that question? I got a call in between. Sorry, tell me.
Sir, as you mentioned these AI tools and the advancement in medical facilities, so I want your insight if there is advancement in dentistry, in dental field regarding this in multi-speciality hospital.
It is. A dental field is very, very, very strongly evolving in this field. There is robotic dental also. So
Yes.
yeah, there's. I mean, of course, it's very few, and the instruments are very little in CMR. There is a company called Cambridge Robotics based out of Cambridge in the UK, and we are very closely associated. They are now trying to make some equipments for us for maxillofacial surgery and all that. So definitely, it's going to pervade in all fields, Ma. It's not just going to be just in the basic medical field. It's going to be in every life science field for sure. So it's very important to upskill everyone.
Okay, sir. Thank you.
Okay. So
one more doubt, sir.
Yeah, please go ahead.
Sir, normally by seeing symptoms, suppose if it is a fever, just we will Google it and what are the symptoms regarding the fever, and it is one of the symptom for so many things.
Yeah.
How this AI will come to know by seeing the symptoms? This is that. I mean, which disease? I'm not get. I'm
Okay. No, I understand your question. Now let me say, see, I'm a physician, right? Now, if I know that I ask my nurse to check for everything as soon as a patient comes. So what happens is they say, okay, this patient has got fever. So now I know what to do. I know the patient has fever, which means there's an infection in the body, right? One of the common causes. Then I ask for some blood tests, right?
Yes.
Now, and then blood test comes, and whatever comes, the leukocytosis is there. There's increased lymphocytes, and I know that some infections happening. So now there is a limit to what my knowledge. I know what I've read in medicine. I've read so many papers, but then the AI system has millions of pages it knows. I don't know millions of pages, right? In my experience, I know only what I read. But the AI, within 1 second, it can go through all the million pages and it can sift through all the different diagnoses and then say, this is the best diagnosis, right? So see, there was a system called Watson. I don't know how many of you know IBM Watson. IBM Watson was such a beautiful machine from IBM where it had billions of data at its fingertips. Okay. All you have to see, in fact, there was a study, not a study, it's a real case where for one particular type of cancer, they only brought it out for cancer first. One particular type of cancer where, for instance, stomach cancer, we have a protocol, right? And we give only those drugs, the chemotherapy drugs. But when but there was no improvement in the patient. They ran it through IBM Watson, and that IBM Watson said, for this patient, you give another drug. And that drug is not used for stomach cancer at all. It's used for some throat cancer. But because IBM Watson said they gave it, and the patient recovered. Because it found in certain cases alone, it works differently, and no oncologist knew that also.
Okay.
Yeah, because the IBM Watson is so powerful, it was able to go through all the data and say, try this drug. So that is the idea of AI. Unfortunately, it didn't become commercially viable because it's very expensive. Each system was costing $200,000, which is, I don't know, more than 1 crore rupees. But very soon, all that will become cheaper, ma. So we are hoping to do that. But that's how AI can help.
Okay. Thank you, sir.
You're welcome. Is there any more?
So, last one question, sir.
Sure.
So, after having all this digitalization and all coming to India, uh, after knowing some data, I came to a conclusion that India is still lagging behind so many other countries in terms of healthcare. Why do you think it is still like this?
See, it's very simple. What India's population is 85% rural, right? Our government system, healthcare systems are not yet strong enough. That is the problem. Private healthcare, you think doctors go rural? No, they don't. Because why? There's no money there. They also have to survive. So government systems has to improve. It's improving now. I know that. It's improving day by day. But it will take some time. Now you take US, you take other. See, our spend, that's the saddest part. India's spend on healthcare is 1.3% of GDP, which is among the lowest. See, India's GDP is the fourth largest in the world now, right? But the top 10 or top 20 nations in the world in terms of GDP spend much more than India. India spends very little on healthcare. In the US spends about 6%. Imagine the difference. So we need to spend more money. The government has to spend more money. Private groups will not really go to the rural areas because it's very difficult to provide healthcare and very difficult for them to get return on investment. So this is the reason why is the government is not being strong enough to prioritize healthcare. That's the main reason.
Oh, thanks.
Yeah, sure.
Sir, I have a question.
Go ahead, Lokesh.
Sir, coming to the AI and its implementation or else usage in the medical field, or using the data of people or else patients, and then the data is coming into the market for commercial use, or actually ethically we have to think that we have to improve the quality of life of a person or a patient by using this data. So
Yes.
how far this AI is going to help to improve the quality of life of a person?
See, it's like you rightly said, we need data. Otherwise, we can't train the AI, right? It's like clinical research. How are drugs made? New drugs are tested. And what is very important there is the consent of the patient. So even for training AI, we have a consent form. We tell them. And only when they sign, we use that data. There are people who don't want to give the data, we don't use them. So constantly data, with their permission, we take data and train the AI and the ML engine. Okay.
Yes, there is a chance of unethical uses of data, right?
See, that's the thing.
Within
That is where cyber security comes in, isn't it? We've spoken about this. So we must make sure CDCSO has certain safeguards in place. People can't just collect data and use it for training. That's not right. And if an app comes out, there is a particular security, the security system called WAPT. We have to go through that kind of testing. Only when you get a WAPT certificate, you can release an app into the market. Right?
Thank you, sir.
Yeah.
Excuse me, sir.
Yeah.
Sir, keeping in mind about the current global economic situation present, is it possible that such technology will be soon available everywhere and accessible easily?
Yes, it will definitely be there. It will definitely be there because it is getting cheaper by the day. Technology is getting cheaper and it's getting more and more accurate. So eventually it will become very, very affordable.
Sir, if this technology will become affordable, then obviously the new technology will come ahead of this.
Correct.
Then
of course. It's a cycle, isn't it?
Yes.
Any new technology is going to be expensive, It's not going to be cheap. Because eventually that will become, right from the, I don't know, from 100 years, how much of this whole century has been full of innovation.
Yes.
Right? So mobile phones now are available for 2,000 rupees. When it came, it was minimum of 50,000. right?
Yes,
So
yes.
next is going to be the Google Glass. When it comes, it will be $3,000. After 5 years, it will become $50.
Okay.
So it goes through a cycle.
Okay.
Yeah.
Yes. Thank you.
Anyone else? So I'm going to play a video. This is an app which my company has developed. It's called, I'm the CEO of a company called Helia Digital, which is based in the US, and I'm the Indian CEO. But we have tried up with a US company called Trustar, and you just see the video, and then I'll take a few more questions. I think we're already way past our time, but I want you guys to see this. I hope you can all see my screen still.
Yes, sir, we can see your screen.
Yeah.
The Truster platform about. Truster is an artificial intelligence-based software that uses your cell phone as the device. This software looks at light reflection from the skin on the face and the blood vessels under the facial skin. This enables a real-time measurement of pulse rate, blood pressure, oxygen, stress level, average blood sugar level or HbA1c, the hemoglobin level, serum cholesterol, etc., all in less than a minute, along with several other heart and lung health indices. All these results go to the back end of the Truster app, where they are visualized to present a trend graph of each of these vital parameters. Whenever any report is above or below the required threshold level, the Truster app automatically sends an alert to the doctor. A telehealth call with the doctor or caregiver can be scheduled, and the recorded call can be sent to 2 legal nominees. Truster thus empowers individuals to maintain all the vital parameters within a safe range all the time. This ultimately results in a huge reduction of death in the workspace, either from cardiac or cerebral vascular issues.
Okay, so that is an app which we are developing now. So I'll be happy to take any final questions. So it, as you saw that, you just, any camera can be used, right? You can just look at it. In 45 seconds, it'll give you a BP, pulse rate, SpO2, blah, blah, blah. But as I said earlier, we don't have FDA approval yet. We only now use it in large companies as a screening tool. It shows if you have temperature, but only as a screening tool. But eventually, in about 12 months, we hope to get FDA approval, where it will become extremely accurate. Okay, so you just have to look into a camera, and we are working with the Israeli AI company for this one. So, and what we are now currently working on is even blood test, like blood sugar, hemoglobin, and blood urea. Everything can be measured by just looking into the phone.
Sir, generally, if we think like humanly, like if we think, how is facial recognition linked with our blood sugar levels, and how we
Exactly.
can detect?
Yeah. So this is a method called plasma plethysmography. Okay, it's a very new thing. It's like, you know, an SpO2, you just put your finger and it senses, right? It's a sensor. This studies the blood flow under your skin. Okay, and based on the blood flow, it's able to predict certain parameters. All these things are happening. So it's just like you know, Google has come with something where you look into it and it actually scans your fundus, the fundus of your eye, right? And with regular training, actually, I don't know all people of how many of you know this hospital called Arvind Eye Hospital. They gave their data. Arvind Eye Hospital, everyday OP is about 1 lakh patients. So they gave their data, and Google trained their machine on that, and it's become extremely accurate. So over time, all these technologies are going to come. So basically, to answer your question, it reads the blood flow below the skin, which is why when it looks at your skin and studies that and gives out the results.
So, what kind of data was used to train this model?
ಬಿಸಿನೀರ್ ತರಕ್ ಹೋಗೋಣ ಕುಣ್ಸಕ್ಕೆ 104 ಡಿಗ್ರಿ ಐತಿ. ಅದು ಬಿಸಿನೀರ ಉಗುರು ಬೆಚ್ಚಗೆ ನೀರು.
Okay. So, yeah, can I have the question again, please? I didn't hear that clearly.
Yes. What kind of data was used to train this model?
See, for instance, okay, see, when we trained this data, we took patients' blood separately, okay, and then we also did using this AI system and compared results. And then we found out it's only about 80% accurate. But what the system AI ML engine will use is you do more and more tests like this, and then compare it, keep comparing the real data, and then it learns which is right, which is wrong. You understand?
Okay, so for the facial recognition, you might want to use images, right?
Yeah, images meaning it's actually live captured images. So we see, for instance, in our hospital, we did a trial with about 1,000 patients. Okay, so the moment they got their blood test done with our physician, we asked how many of them, we have a consent form. Those who consented to go through this test, they came to another room where the system was set up, a mobile camera was set up. Okay, the normal mobile, and it had the patients had to sit in the middle with their face in the middle of a screen, and there's a oval, and they have to sit there, and then this system captured it, and then the ML engine captured all the parameters, and then we fed the actual values taken by the blood also. Okay.
Okay.
Like that, the AI ML engine keeps reading how much is accurate, and little by little, the more it reads, the more patient sample is higher, it becomes more and more accurate. So you actually have to do an actual blood test, and then you have to do and then a measurement like this with the AI PPP, what we call plethysmography, PPG signals, and then compare both, and the AI ML engine will do the rest.
Okay, got it.
Okay.
Thank you.
Yeah. All right. I think we have way past our time. So I think I would like to close with this, unless any of you have. And Clini Launch, yeah.
Yes, good evening, Dr. Natesh. We will do one thing. I will circulate one form with the students. If they have any concern, we will get that. And
yeah, please. I'll be very happy to answer more questions. And if anyone of you want to get in touch with me, they have my number and all. I'll be happy to chat with you.
And thank you, sir. Thank you so much for spending your valuable time with us. And it's really great. And the students have learned many things from your experience and your insights. It's really
Thank
good
you so much.
to be
Thank
here.
you, Vamsi. Thank
Yeah.
you so much. Thank you
so
very
much.
much.
Yeah. Thank you, students. Thank you for joining with us.
Good night, students. Thank you.
Thank you so much, sir. Have a great
Thank
evening.
you, sir. Thank you, sir.
Thank you.
Thank you,
Thank you,
sir.
sir.
Thank you, sir.
Thank you so much, sir, for giving me this valuable information.
Thank you all. Thank you for listening. Thank you.
The students, I will share one feedback form in the WhatsApp group. Please kindly share your feedback with us.
Hello, sir. Good evening, sir. I am not in the WhatsApp group, sir. So can you add me?
I will check. Yeah, I will. Placement team will add you in the WhatsApp group.
Okay, sir.
Yes, thank
And
you
sir,
so much.
sir,
I must have not in the group, sir.
can I get this session in recorded format, sir? From
We
beginning, I could not
we
hear
will
it.
also share it in LMS. You will get it the link.
Okay, so in LMS there will be recording session for this.
I will check and I will let you know.
Okay.
Hello,
Okay,
sir. Hello, sir.
Yes. You know your
Yeah,
name?
this is Lingesh. My name is Lingesh from
Please tell
Chennai.
me. Yes.
Due to LMS issue, I am unable to hear the half of the meeting. So can I get this meetings video?
Yes, it's already
Recorded
recorded,
version?
and I will do one thing. I will check with Manish, and if possible, we will share the recorded session in the LMS so that you guys can listen.
Yeah, sir, for and previous yesterday's placements queries also the same issue for some people's like we are in the south side. Some people's we are facing the issues. Can I get last four videos, last recent four videos of LMS?
That I need to check with Manish, and I will do that tomorrow early morning. First off.
Yes, sir. May I know your email ID, sir? Please in chat box. Natasha Bola, sir.
Which email ID?
You may know your email ID, sir, in a chat box.
You don't have to take my email ID. I will check with Manish. He will help you out. He will get back to you.
Okay, thank you.
Thank you. Thank you, students. Thank you for joining me this session. Have a great evening. See you tomorrow.